Hello everyone, this video is about snake bites. In the world, more than 3,500 species of snakes are found and around 600 of them are venomous. The difference between venom and poison is that venoms are injected via stings and bites, whereas poisons are consumed, inhaled, or absorbed through the skin. And it is well explained in this meme that if you lick it and get sick, then it is poisonous, whereas if it bites you and you get sick, then it's venomous. Here are some examples of common venomous snakes that are found in the Southeast Asian regions. So we have spectacled cobra, common krait, adult Russell's viper, pit vipers. And these are some non-venomous snakes like rat snake, common wolf snake, and copper-headed trinket snake. First, let's look at the difference between venomous and non-venomous snakes. So first, if you look at the eyes, then the pit vipers have elliptical pupil, whereas the non-venomous snakes have round eye pupil. There is a pit just behind the nostril, whereas this is absent in the non-venomous snakes. And one of the most distinctive features is that venomous snakes have two large hollow fangs, whereas non-venomous snakes have only small hooked teeth. And also, if you look at the shape of the head, then pit vipers have triangular head, whereas the non-venomous snakes have rounded head. To differentiate between venomous and non-venomous snakes' bite mark, then you will see two large fang marks on the bite side of venomous snakes, whereas there won't be any fang marks in case of non-poisonous snakes. And if you look at the tails, then the venomous snakes have a single row of subcaudal plates, whereas non-venomous snakes will have double row of subcaudal plates. Some risk factors for snake bite includes occupation like farmers, fishermen, animal herders and army, sleeping on the floor, open style habitation, hot climate, high seasonal rainfall and high number of rodents or mouses around your house. There are mainly two types of snakes that are found in the Asian region. They are mainly Elapidae and Viperidae. And the Elapidae includes cobra and krait, whereas Viperidae includes vipers. These snakes produce neurotoxins which affect the nervous system and cause paralysis of muscles, whereas the hematotoxins from the vipers will affect the blood and cause blood clot or bleeding. Some neurotoxic features due to bite from cobra and krait include ptosis, which is inability to open eye completely. Then the person is unable to protrude his or her tongue out from the level of incisors. Then there is something called as broken neck sign, where the patient is unable to hold their neck straight when sitting up due to the weakness of flexor muscles of the neck. So the flexor muscles of the neck will get weak and hence the extensor muscles will get stronger, and when they contract they will give this broken neck appearance. Ophthalmoplegia, which will cause blurred or double vision. Other neurotoxic features include skeletal muscle weakness, loss of gag reflex, respiratory failure, and it is the most dangerous sign because it can lead to death, and then inability to open mouth. The hematotoxic features due to bite from vipers include gum bleeding, nose bleeding, hematuria, vaginal bleeding, bleeding into tears, internal organ bleeding like in brain, lungs, abdomen, and then GI bleedings. Toxic from some snakes like cobra and Russell viper can also affect the tissues, hence they are also called cyto or histotoxins. They usually affect the muscles and the connective tissues and cause swelling, blister and necrosis. What are the signs and symptoms of a snake bite? In some people, there might be no any clinical features, and this might be due to a bite by a non-venomous snake or a dry bite, which means when the venomous snake bites but it does not inject its venom into the person. Then there can be local manifestation of envenomation if the snake actually injects its venom, and also there can be systemic manifestation of envenomations, which includes neurotoxicity and hematotoxicity as we have discussed before. The local features of envenomation includes fang marks. There can be single or double large puncture marks, but they are not very helpful on differentiating between venomous snake bite or non-venomous snake bite, because some non-venomous snakes may also have larger teeth and they can give similar appearances, and also some venomous snakes with broken fangs may not have fang marks at all. Venomous snake bite from Kareth may leave no marks at all. Then bite from cobra can cause local pain, swelling, blister, and bulla formation. There can be local necrosis and abscess if infected. Bite from viper can lead to local pain, swelling, blistering, necrosis, and then persistent bleeding and lymphadenopathy. Whereas bite from karat may have no local signs and can be painless. What are the things that should be avoided in a snake bite? So, first thing is that you do not wait for symptoms to appear. So, get immediate medical help. The current guidelines do not suggest to apply tight tourniquet because it might lead to gangrene, necrosis, and loss of limb. Whereas, if the tourniquet is already applied, then do not release it until the treatment process has started. This is because after you apply the tourniquet, the venoms can actually get pulled on the parts that are distal to the bite area. And when you release the tourniquet, then the venoms from this part can easily disseminate into the whole body. Next thing is that you do not cut open a bite wound or try to shock out the venom. Do not attempt to kill or catch this snake, not even a dead one or its decapitated head, because the head of some decapitated snakes can still have some bite reflex. Do not immerse the wound in water and do not apply chemicals or cow dungs. Now, on to the first aid management of snake bite. You should seek medical attention as soon as possible. Do not wait for symptoms to occur. Also, driving oneself to the hospital is not recommended as the patient may get drowsy or faint on the way. You should stay calm and reassure the patient. Take photograph of the snake from a safe distance if possible. If the snake is already killed, then bring it to the hospital to identify the species. Remove items such as tight clothing, rings, and jewelries. Wash the bite area with soap and clean running water. Immobilize the beaten area. You can use a splint or sling to immobilize and beaten area. The victim should assume a resting position with the affected area below the level of heart. The wound or the limb may be covered with a clean, dry bandage or dressing. Here is an easy mnemonic for the first aid management of snake bite. It's called RIGST, right? So R stands for reassure the patient. I for immobilize the beaten part without tight tourniquets. GH stands for get the patient to hospital as soon as possible because antivenom is the only cure for a venomous snake bite. And then last is T stands for tell the sign or symptoms such as drooping eyelids that happens on the way to the hospital. Now on to the management of snake bites. Snake bite is a medical emergency, so we need to rapidly assess the patient, look for airway, breathing, circulation, disability, exposure. If there is absence of pulse or breathing, then you may need to provide with CPR. Give anti-snake venom, it is the most important step. Give oxygen. And if the patient is not breathing well, then you might need to intubate the patient. You can give fluid therapy or blood transfusion if there are signs of heavy bleeding, like in case of hematotoxic vipers. Do wound care. Broad spectrum antibiotics might be needed for possible infection. Tetanus vaccination should be done. But if there are no features of snake envenomation, then admit the patient for observation for 12 to 24 hours. Now let's talk about anti-snake venom. It is prepared from horse serum. So in this picture you can see anti-snake venom. In this vial it contains the powder form of anti-snake venom, and here is the sterile water for injection, which is then mixed with this powder to form a solution. And this is how they collect the venoms from the snakes. The collected venoms are then injected to the horses, and from the horse the blood are collected, and from the blood the antibodies against the snake venom are segregated, and then antivenoms are made from these antibodies. Anti-snake venom are of two types. They are monovalent anti-snake venom and polyvalent anti-snake venom. The monovalent anti-snake venom contains neutralizing antibodies raised against one species of snake venom, whereas in polyvalent anti-snake venom, it contains neutralizing antibodies raised against two or more species of snake venoms. The polyvalent anti-snake venoms that are commonly used in countries like India, Nepal, Bangladesh, it contains anti-snake venom against Russell viper, common cobra, common krait, and saw-scaled vipers. The anti-snake venom, it comes in a powder form and it is to be mixed with 10 ml of distilled water for use. It is given in slow IV bolus or infusion. But this has a high risk of allergy or anaphylactic reaction. Hence, prophylactic adrenaline is given before giving anti-snake venom. 1 ml of anti-snake venom can neutralize 0.6 mg of Indian cobra venom, 0.6 mg of Russell's viper venom, 0.45 mg of common krait venom, and 0.45 mg of saw-scaled venom. On an average, snakes release 60 to 70 milligram of venom in a bite. And the maximum venom is released by Russell's viper, which is around 147 milligram. So now about the so now on to the use of antivenoms. Prophylactic adrenaline 0.25 to 0.3 ml subcutaneously is given to prevent anaphylaxis. Antivenom infusion at the rate of 1 to 2 milliliter per minute. Antivenom dose. Neurotoxic envenomation. We use 10 vials diluted and infused. Then we repeat with 5 vials IV push if neurological signs worsen. In case of hematotoxic envenoming, 10 vials diluted and infused. Repeat with 5 vials IV push after 6 hours if the coagulation tests are still abnormal. We need to note that adult and children have same dose as snake injects same amount of venom. Do not use more than 20 to 30 vials of antivenom in a patient. We need to observe the patient for antivenom reactions and treat accordingly. Here are some common signs of anaphylaxis. There can be features of headache, anxiety, difficulty in breathing, stridor, shortness of breath, abdominal pain, skin rashes, itching, swelling, faster heart rate, and low blood pressure. Now, onto the prevention from snake bite. Community education and awareness programs should be done. Keep the household areas clean of tall grasses, bushes, heap of wood piles, rubbish, and building materials. Prevent entry of snake into the house by closing the doors and windows. Snakes enter the house in search for shelter from rainwater, foods, rats, chicken, etc. Avoid sleeping on the floor as much as possible. Use mosquito nets tucked well under the mattress. Wear high boots and long pants when walking in risky areas. Use light while walking at night. Use a stick to strike the path. Snakes will move away themselves. Do not play with the snakes. When encountering snake, do not provoke or try to handle, trap or kill the snake. And you need to note that even dead snakes may bite due to jaw reflex. Wear leather gloves when handling brush or debris. Check shoes and clothes before wearing them. So that's it for today. Thank you.